Hello, I am Dr. Ravi Mathur, having 50 years of experience in the medical field. Today, I will talk about what is dengue, what are the causes, its symptoms, diagnosis, and treatment of dengue fever. Dengue fever is a mosquito-borne viral disease which is caused by the bite by a female Aedes infected mosquito. Dengue virus are of four types, D, E, and B. There are four types of dengue virus. Out of them, type 2 and type 4 are more important. Dengue fever is mainly transmitted by the bites by infected female Aedes mosquitoes who grow up in the man-made water containers or water bodies. These mosquitoes are active especially during the daytime. Dengue fever is more common after the rainy seasons. At that time, the population of mosquitoes is at its peak. Dengue fever don't spread from person to person. It is not a contagious disease. It spreads when one infected Aedes female mosquito who bites and feed one infected person, that mosquito is now infected. When this infected mosquito bites a healthy person, the dengue virus are transferred and transmitted to that normal person and causing the fever, the dengue. Now the symptoms of the dengue fever. In early stages, the symptoms can be mild, but in few cases, after few days, they become extremely severe. Main symptom is high fever, fever reaching up to 104 degree Fahrenheit, and it is continuous in nature. Another symptom is severe headache, pain behind the eyeballs. Another symptom is muscular and joint pains. It is so severe that it makes a person crippled. Another symptom is patient may feel nausea or vomiting, which may occur 3 to 4 times a day. After a few days, superficial skin patches may appear. The person feels fatigue, malaise, and weakness. Sometimes there may be hemorrhages or bleeding, mainly from gums, and if there are any bruises. Another symptoms may be abdominal pain and difficulty in breathing. In severe dengue fever or hemorrhagic fever, the condition may become grave and then a person needs emergency medical treatment. In severe dengue fever, the above symptoms become very grave. The patient may have a high-grade fever, abdominal pain, severe nausea, and frequency of vomiting. Now the patient develop shallow breathing or difficulty in breathing. Bleeding become more severe. Now it comes from nostril, gums, or hemorrhagic patches may appear under the skin. The person may become restless and irritable. Now the diagnosis. Diagnosis of dengue fever depends upon a travel history. If there is any history of travel to the endemic area, there are chances that the person may have contracted the dengue. Next is symptoms. As per the symptoms, we can diagnose the dengue. And next is investigations, which is very important in diagnosing dengue fever. In the investigation, the very important test is platelet count. In dengue, the platelet counts become low, thrombocytopenia. It is very important. In dengue fever, the bone marrow which forms platelet is involved. So there is no formation of platelets and gradually the platelet counts come down. The normal level of platelet is 1.5 lakhs to 4 lakhs per microliter. In dengue, it comes down to 50,000 per microliter or below it. Another test we do is for white blood cells, WBC. They are also low in count. The condition is known as leukopenia. Another test is hematocrit, which indicates the plasma leakage. In specific tests for dengue, we do antigen test in which we look for the dengue virus protein. A specific test also include ELISA test, and there is another test known as RT-PCR test for dengue. So the diagnosis of dengue depends upon the travel history, symptoms, and the investigations. Now, the treatment of dengue fever. In fact, there is no specific treatment for the dengue fever. Most of the patients are treated with the focus on prevention of complications and relief of symptoms. Treatment is simply supportive and palliative in nature. Mild cases of dengue fever can be treated at home. We advise patient to take plenty of rest as patient is having abdominal pain, muscle pain, joints pain, he is crippled. So we ask patient to avoid physical activities. Hydration is the next part of treatment. We ask patient to take plenty of water, ORS powder, or plenty of juices, because there is lot of loss of fluid because of fever and vomiting. We advise patient to take paracetamol to relieve fever and pain, but don't take aspirin, ibuprofen, or non-steroidal drugs as they cause bleeding, so we should avoid these medicines. You should take supportive and palliative medicines as per the advice of your physician. In severe cases of dengue fever, we need to hospitalize the patient where they are given IV fluids, supportive and palliative medicines, and if the platelet count has come down below 50,000, then a platelet transfusion is needed. Right now, there is no specific vaccine against dengue fever. They are in a very early developmental stage. So this was all about the dengue fever. If you have liked my talk, please like it and subscribe it. Thank you.